Your humerus, your radius, and your ulna. The ulna is the bone that gives you the point of the elbow.
Okay.
Okay. And that is the bone where this medial coronoid process is. So when we open the joint up, the medial coronoid is this bit of the bone right here. Okay. And what happens is as the dog goes and exercises, usually in what we call extension, and they land with impact, that coronoid process bears a lot of the weight. And if the bone underneath here is not normal and this is unstable, it gives them that, pebble in the shoe kind of feel. That's the painful part. Radiographically, what we'll see is sclerosis or hardening of the bone behind this part. There'll be, and I actually can see just a little bit of a fissure in part of this bone here. And then on the outside, they'll get proliferative arthritic change. She doesn't have a lot of proliferative arthritic change, but she does have that little line in the bone down below the cartilage surface that worries me a little bit and makes me think you may end up having to go to surgery. However, I would try medical therapy with her first.
Okay.
She's 8 years old.
Yeah.
Okay. For her to not have an extensive amount of arthritic change in the elbow, I think that probably your best bet is to inject this elbow with a combination of a steroid and a hyaluronic acid and polysulfated glycosaminoglycans. It's basically joint fluid and structures that will help support the matrix of the articular cartilage. We sedate the animal, we stick a needle into the joint and inject it. I usually have you lay them off for a week and then see how they do. I have some patients that will inject them and they do great and I never see them again. I have other patients that I inject them and anywhere from 6 months to a year later they'll start to show signs again. We'll inject a second time. If we have to inject more than twice, probably thinking that surgery is a more reasonable way to go.
Okay.
The other thing that you can do is what, it was Dr. Bolt you saw?
Yeah.
Yeah, is what he had you do, which is treat with anti-inflammatories. And the anti-inflammatories definitely will help. You need to combine that with rest. But usually what will happen with these dogs is you rest them, you treat them with anti-inflammatories, let the joint quiet down. The dog will do fine until she runs and twists just right and puts pressure on that coronoid process, and then you start the inflammatory deal all over again.
Huh.
Okay? And think about how this elbow is, right? Because your elbow does this too.
Right.
Okay? So it goes that way and it floats like this. And this process right here is just poking on the inside of that joint.
Wow.
Okay?